gap. I think, when we think about rare diseases in general, sometimes there's a lack of awareness. For example, the rare disease that I'm most familiar with is lysosomal acid lipase deficiency. Only about 135 cases have ever been reported worldwide. And a couple of years ago, I was referred 4 brothers with marked hyperlipidemia, hepatomegaly, liver enzyme elevation that was unexplained. And evaluating these children and their parents, I recalled from a number of years ago when I was a fellow at the Mayo Clinic reading about lysosomal acid lipase deficiency. At that time it was called cholesterol ester storage disease. And we made the diagnosis. And it's a life-threatening disease, and thankfully we made it at a time that there was treatment. At the time we diagnosed it, there was an experimental enzyme replacement which replaces the enzyme that is missing in this rare disease because of the mutations in the genes that preclude normal production of this lysosomal enzyme. And so now the experimental agent is commercially available, and the 4 patients of ours have been on it now for 2.5 years, and they're doing quite well. And thank God, because essentially it saved their lives. I think when we talk about rare diseases, I think sometimes the biggest issue is the lack of awareness. That's what I've experienced. The number of physicians that have ever heard of lysosomal acid lipase deficiency is probably less than 0.1%. So I think it's incumbent upon the various medical organizations to increase awareness of these rare diseases, because many of them are life-threatening, and as technology and treatments advance, it becomes incumbent for us to understand these diseases and be able to diagnose them, and then if treatment is available, institute many times life-saving treatment.